Hey there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Now we got that annoying name out of the way. Let's dive into what we want to talk about today. You may not be aware of this, but neuropathy is a pretty painful condition that develops often. Well, if you drink too much, then you earned it. But some people, diabetics get it, and chemotherapy gets it. And what happens is the nerves start to deaden. And the further away from the heart, it seems to happen. So your hands and your feet typically are affected first and foremost with, and usually the legs more so with the feet. I mean, people before, it's like they're walking on rocks or walking on broken glass. Change the sensation. Some of the nerves aren't working properly. Now, if you think there's a medication that's going to fix that, just, I would say, hang up the phone. Just don't bother listening to what I got to tell you. But there are simple exercises you can do to work with the brain, because the brain is the controlling module for everything. So if you have issues going on in your brain that can be mitigated or a spot to help stimulate the nerves, that's going to be it. But just because the symptom is in your foot doesn't mean it can't be helped. It needs to be stimulated. All right. So I want to throw a big name at you. Okay. And it's an area in the brainstem that integrates sensory input, motor control, and reflexive activity. So it's called the Pontomedullary Reticular Formation. It is a wickedly long name. Pontomedullary Reticular Formation. PMRF for shortness. And I might as well keep it short because I don't expect anybody to remember Pontomedullary Reticular Formation. Okay? You need to know what's in the brainstem. And it is in the base of the brainstem, basically, and it's in the pons and the medulla, and it's the lower part of the brainstem. It's kind of like just rub your hands to a little bump in the back of your head where your skull meets the spine. It's kind of inside the skull there. Okay, so what happens with the PEMF? Okay. It's a major player in maintaining upright posture and muscle tone. So what does that mean? Well, I don't know if you noticed this, but people who have neuropathy or any real neurological deficits like advanced dementia, Parkinson's, Alzheimer's, you kind of see them hunching forward. And so what happens is the extensors, okay, extensor muscles aren't really firing as well. So you kind of lean forward. It's not a good thing because your brain wants that information. So we're talking about really, we're going to use the visual and vestibular systems here to make you work a little bit better, make your brain work a little bit better so it can integrate all of these different things that come into the PMRF, okay? Let's go back again. It's the key region in the brainstem, integrates sensory input, motor control, and reflexive activity, all right? So you're sending information from your feet and it's faulty. The brain's going, what? What's going on here? I don't know. But it helps, again, in maintaining upright position. So you're not getting enough information. Believe it or not, the bottom of your foot is loaded with nerves, and those nerves need to stimulate and send signals to the brain. And they send it, up the spinal cord to the cerebellum, and the cerebellum shifts it over to the opposite side of your head where the motor control is, okay? So muscle tone is on one side, muscle control is on the other side of your brain for the left side. So you have left side tone, muscle tone. On the right side, you're going to have motor control, all right? So the PMRF, Pontomedullary Reticular Formation, integrates sensory feedback for the visual, vestibular, and proprioceptive systems to make motor output smooth and adaptive, okay? If you're walking on rocks, your brain's got to be aware of it. But anyhow, works with the cerebellum to fine-tune movement patterns as well. It's kind of like polishing your shoes before you go out to work one time. And, so you're fine-tuning your look when you polish your shoes. The PMRF kind of polishes fine-tuned movements, which is important. Now, it's also works with the postural reflexes. That has to do with gait control and balance reaction. So, what happens is the PMRF can really excite or inhibit muscles depending on what's going on. So if you're not sure of where you're walking, your brain's not sure of it. It's not really clear. It's going to inhibit. So what happens is you move less. Okay, that is a real important thing. Now, thing as far as the pain you can experience with peripheral neuropathy, the PMRF is involved with what's called descending inhibitory pathways. So it influences how your spinal cord processes pain. Because, you can have pain and numbness in your foot, walking on glass, walking on rocks, can't feel your toes, burning, stinging, like bugs are crawling, all that good stuff that goes on with peripheral neuropathy. What happens here is you're going to start to see, your gait's going to go awry. You're not going to notice the gait issue. You're just not going to. You're going to be stuck on the symptom, okay? Because a gait issue is how you walk really could come from, how your brain is taking the information is going to see how your gait really is. So if you have issues with, it could be stroke, trauma, degenerative conditions like peripheral neuropathy can cause postural instability, poor balance, abnormal muscle tone, and gait difficulties. Okay. So what we try to do is we try to give you exercises involving visual and vestibular training to help stimulate the PMRF activity to improve balance and motor control. Okay. So I know I'm getting really long-winded in here. So why is PMRF rehab important for neuropathy patients? It's important because peripheral neuropathy damages sensory nerves in the feet and legs and the arms and the hands, and it disrupts proprioception. Proprioception is your body position awareness. So if your brain doesn't know, if it can't find your big toe, that's a bit of a problem. It's not going to seem a problem to you. It's a problem to your brain. So the brain's not getting what it needs, and it's looking for that information. If it was two other types of nerves that elicit pain, well, that's an okay thing. But now the PMRF also is involved with inhibiting pain. All right. So if you can spark up the PMRF, you have a better shot at dealing with your neuropathy issues, among other things. So think of it, the PMRF as a central hub, and it takes in sensory input from the vision, vestibular, and proprioception, and then adjusts posture and muscle tone. So a weak PMRF activity, poor balance, slower reaction times, and worse, increased risk. Okay? No one wants to have increased risk falls. No one. So it's safe to say you want to avoid falls, but is there really something you're thinking about? We just have a little numbness, you're more focused. It would help to shift your thought process, because a fall is really serious when you can't feel your feet. And it leads to these disastrous changes. People hit their heads. They break a hip. It's just not a good scene to fall. But if you work on your balance, okay, you don't have to spend a lot of money. There's ways to do balance exercises at home. And basically, the patients that come in for neuropathy care here. Now, I don't cure neuropathy. Nobody does. What I do is try to optimize functioning of the nerves and how it relates to oxygen delivery, what nutrition the nerve needs. That's along those ways. So, again, if somebody's telling you they're going to cure neuropathy, hang up the phone or go somewhere else. Or let me know so I can find out what they're doing successful. All right. So, again, why the Pontomedullary Reticular Formation is important. Peripheral neuropathy damages the sensory nerves in the feet. So it disrupts the ability of the brain to know where your body parts are. There's a section of your brain, the primary somatosensory cortex. It's right near. It's right after the primary motor cortex. Big areas as far as taking sensory input and then processing it out, so you get a motor output. So the PMRF acts as a central hub. It takes in this information from the vision, vestibular, and proprioceptors, and then adjusts posture and muscle tone. Weak PMRF activity can lead to poor balance, slower reaction times, increased fall risk. So what are you going to do? Balance exercises. Well, the balance exercises are good, but there's things you can do to stimulate that part of the brain that It's getting these information to make sure it's getting to where it needs to go in the brain so your brain can respond appropriately. All right. So when you start doing some rehab goals, here's what you got to think about is you want to stimulate and strengthen these pathways. You want to compensate for lost sensory feedback from the feet by enhancing visual and vestibular. Okay. So if one system is down and you got two backups, you're doing pretty good. You want to restore symmetrical muscle tone in the trunk and proximal muscles for better postural control. This is where the PMRF, postural control at the base of your brain, the medulla oblongata, and the pons. I don't think you need to know all those other names, but that's the only way I can explain it is by giving you all the long worded things. It's Friday afternoon. Go with me. All right. So here's some very basic thing. Visual stimulation, smooth pursuits, and saccadic eye movements, okay? And what happens here is it's easy to just do both sides. The pursuit is you follow if you went on your computer, you look at your computer and you hit M and you just keep it pressed. It keeps going all the way down to one side. You keep your head straight, look at it. That's a smooth pursuit. Another way to do it is you look to the left, look to the right, look to the left, look to the right, look to the left, look to the right, and do it far enough that your eyes are far enough apart. Very, very important to work that PMRF, okay? Now, one's called a saccade, one's called a smooth pursuit. Simple, very easy to follow. Now, here's one too, this is for the frontal lobe. So we're trying to get you to understand a lot of stuff is not just in the head or in the feet. I mean, that's where you feel it, but all that stuff is really perceived in the brain where that issue is. So gaze stability, that's where you're going to look at something. Here's what I do. I tell my patients, I said, okay, take you brush your teeth. I'm assuming you brush your teeth at least twice a day. You're standing in front of the mirror. Right about the level of the bridge of your nose, you put a dab of toothpaste onto the mirror. All right? And what you're going to do is you're going to stare at it. You're going to stare at it. You can stare at it. If you could do a minute, you'd be surprised how hard it is. But this is a way to stimulate the frontal lobe, which is presynaptic to the primary motor cortex, okay? So there's a method to what we're trying to do here. And that's the visual stimulation, okay? So the proprioceptive stuff is not working. Now we're going to go into vestibular activation. And this is where you're going to work on like a balance platform. You can do this where, there's like pads you can buy to put it, or there's these bouncy balls, that's not really Bosu balls. And you're going to do it with your eyes open and your eyes closed, and it forces the vestibular system. The vestibular system is like a gyro. On a plane, you see the thing, or a boat, you see the gyro go back and forth. I'm not talking gyro that you get at the Greek restaurant. All right? And what happens here is the brain has the anterior, posterior, and horizontal canals, and they work with the visual system. So if there's a problem with the vestibular, it can lead to other problems. So here, balance platform work with eyes open and closed, and it forces vestibular adaptation. Now, for proprioceptive, this is really pretty good stuff. Vibration therapy on the feet and ankles to boost proprioceptive feedback. Really important, very simple, but really good. I also recommend for people who have serious issues some laser therapy, but that's done at home, and it's not cheap, but it's you want to get over this, you understand something. Medicare doesn't cover this stuff, so you better be used to the fact that you're going to be paying, out of pocket for it. So vibration therapy on the feet and ankles to help boost proprioceptive feedback. You do step ups. You can do this at home. You got to step, walk up, bring it down, walk up, bring it down, walk up. You can walk up and put your left foot on one leg, go 2 steps up, the right foot, 2 steps up, left foot, 2 steps up. You're doing is you're sending stimulus to the feet to wake up. Now, another thing too is weighted carries, and that's to activate axial muscle tone. So the weighted carry is when you would just take like a gallon of milk in each hand. All right, do a gallon of milk in each hand. That's the So this is the type of stuff. there's many little things you can do when you're at home. And if you're interested, I'm more than happy to spend a little bit of time with you. You'd have to come in for it. I'll go over these different things with you because and then again, the other thing too is balance at home. You just stand there with your eyes open, eyes closed, not holding on to anything. See how long you can do that for. Okay. Another thing too is when you're walking, keep your head turned to one side, take a few steps, turn your head to the other side. You're stimulating that vestibular system pretty good like that. Slow marching with high knees. That's another easy thing to do. It shouldn't be that hard to do. So basically, what are you looking forward to? I'm going to improve balance, confidence, reduce fall risk, better gait symmetry, which is important, and increase stability during daily activities. So what did we learn today? Pontomedullary Reticular Formation and its importance in neuropathic cases of peripheral neuropathy. Dr. Brian McKay, it's a Friday afternoon. We still got a couple weeks of summer left. Hope you learned something. You have any questions? My office, 203-656-3636, 203-656-3636. Hey, thanks a lot for listening. I hope I didn't bore you or hit you with too many technical words. All right, thanks a lot. Have a good one.